Okay. Okay. The patch on Motiminka.
Yes.
Okay. Yeah. We are on live now. And everybody who is watching us live now, we are going to discuss public health matters. Emre ne mre ano no bia no na ehia se wo nimdie bi ekakra na wo ne wo manfo ache ene nyina for God and country. And say neno we are going to talk about human right-based approach to COVID-19 pandemic fighter. Ghana ene amanyina na a background ekakra ne say as a COVID-19 pandemic no is sweeping across the globe. It has infected some and affected all Ghanaians in some way. So your problem you're dealing with it now is infected people and affected people. And I think say when we talk about affected people, all of us have been affected in one way or the other. And some has been infected with the virus. Now, this has compelled governments all over the globe to engage in public health campaigns, restrictions on social interactions, and then freedom of movement, and a whole lot of things. And then you put say, you know about check. Obia won a right, but a bad pandemic say yeah, right, a buying and she or take your right no ekakra. Na kwan ben so na e was dealing with public health issues say kono in a human rights based approach as against the traditional public health approach not many years ago yetimi edifasono. So online no we were minuamu mienu e wo ha mene omo eba be discuss and yebe di kan ama Richard I introduce ne ho ekakra Mr. Richard Mipacho.
The medium of communication. Previously I was in part Tree or English.
Oh, Tree. Yeah, Tree.
Oh, okay. Yes. Your friend me or say I'm in Richard or Richard or I'm in health service administrator at St. Michael Hospital. Ashanti region, just about 20 minutes drive from Kumasi Mall or central city of Kumasi to the facility. And it lies between the Kumasi city and that of Lake Bosomtwe. That's where my hospital is located. Sorry, my hospital in between Lake Bosomtwe and the central Kumasi. The St. Michael Hospital, 30 minutes drive from Kumasi Central, I'll be in Abajo. My background of public health, my background of administration. I'm a chartered administrator also. And my friend said, before the Kakano, no, and all along the Akusu Ghana, and she, the SNM DIY, I did year, Gruma, our healthcare, the public health. And I be the home common, not young share, maybe to me, Abua Ghana, now Boa, yes, you will be with us, with the winners.
And what's a professional teacher?
I'm a professional teacher. Sorry.
Yes.
Sorry.
Yes.
I'm a professional teacher. Yes. I did education.
You have all the angles. So you have a very broad eye when you're looking at public health issues. from schools and
from schools to hospitals to the environment and the communities.
Yeah, that was say a wajibre. I mean, Mr. Amaniampon is a very, very busy man, and especially on Mondays. Yabeko Francis.
Yeah, me a friend me Francis Amankwa. Sincerely, me a student in public health. Me specializing in health economics. Previously, no, me bachelor's, me degree, me bachelor degree is in accounting. My background in accounting, and me a master's in health economics. We are better how it be to me the me nunu afra na the abuagana. So basically, I'm a student now. Yeah.
Okay. Meda mase. Obi so ama me a message behind the ho. Say hey, me so me eden. Me chia me. Me a chia me. Oh, okay. Me so me Ghana trained teacher. And teaching in a Chinese university too for some years. And a nurse in Finland. And I'm saying me public health. And we are all going to look at these issues from different angles with our little knowledge in public health. No? Now, a topic here, you're discussing public health, human rights-based approach to COVID-19 fights. Before say, me cut deep into the topic, you know. What would you say about that? Looking at the context of a low-income country and fighting a pandemic. What is the human right-based approach to it? Me pacho Mr. Richard obetimi akasama.
I'm say you can say human rights approach ya. I'm say the back in the tree mu say you fa ho deal say maybe I was say yetimi ye. I say bibia ni ho no ma, you say me right.
Me pacho say hwa na odi ache e kakra edu time bia e Ghana line no entire enyina so ye papa.
Hello.
Yeah, I can hear you.
What you mean, guy? Suddenly a confirm. I mean, say me right. I say right. Yeah. I was a minya. I was a castle. You may be I was a minya. And you was I say, oh, me right. This is my right. This is my right. It's true. So the question and answer I say, yeah, what a low or middle income country. Now you fighting COVID. Now it's I consider right. Let me say, meaning take a cry, but I can say, a true baby, not right of movement. Now, yet see and Crawford nice. Because of say, Tama, you call lockdown, because it be any right to get out of Ghana, like within. Crying, you can say, free one community, call the other community. Because say, free maybe say, Ashna, a call a crow from, because Untimin cohort, a soldier for. Na yi so asojafo e wo mu dwuram se we ntimi nkwa ha we ntimi nye we no ma bia o sanka ye nya kra na then time na o se nya no ye ntimi ye nya say ye hwe ya health workers and some category of staff we no mo timi ko but if you are a trader and you be your business so you be our institutions be you say the right to move ye seize ntimi nko ntimi fa say these are some of the issues no ebi no. So, and I mean, the right to get some basic care. That time we hospital free more. network, even food crana.
Internet. A hard journey. A break kick.
Sometimes you need right even to get your choice of food. Food also with the movement aba. Food aba. There are other things, necessary things, yeah. Now you to be crank. Even the right to attain education. Yes, what Ghana school or be at me school.
Yes.
But a Bible so me numnie. You active school no, you know, you stop it. You stop it. Even if you cry, you call it some metro scrap. Now there are activists be cranks. I can say, your mom refugee. It will have how you make a cry way for the meantime. One, makan about school, makan about food, makan about movement. And my way in COVID, I bet na so. I'm a yen sapa who do you know? Miami Hospital as I administrator. Baby, you have to mean raho. At me raho. But then time first, let me to me at any time, any seconds be I met me, let me to me raho. They say, we shall obi crana. Says I would chian cran or chiana usro. Means said Ghana. Your tradition just say, we shall be, especially the account societies. I saw the sacred tone say, now I know a chia. The one she can say, oh, what you want home? Oh, you two know, you can be paying. And she said, I knew who's on way. But Sanyo Manina to a track, Sabri. It means all man distance a cry. Religious. Yes, so your war time will be to me the sum yummy. But you must say, you pass say it to me quite sorry. I sorry to me for 500. Over cost or any 500 penny to her. A selection, the be a back, the be a call. So it is our right to worship in Indian. You can't share. COVID into you can't share.
Yo, yeah, that was it for a comment. Awama, you be ready into it with some principles and a guidelines. And penny 40 minutes to 2 o'clock. Mu here say, "San ye may our cancer ya free and semi no. Ye be consider ye right no so. Francis, the
Yeah.
over to my initial comment.
Yeah, the other kind of say, send me when you penny Richard a kind. You can say human writer, send you didn't kind, HH, a boa, a bah, so ye nipa. A ye, a dear, or bad dear, writing or bad dear na, at the mouth, the fact say, we nipa. So bring to me in Chiwunkum. So, but in the face of COVID-19, no. Send a bar in Pufrim never share your swab Brian in Naya Hosono. Ama yen to me and Tnasi. My yen to me and yen consider them maybe say okay, and Yama will see a share. If you are teach you be found with this, so here we teach you be found with this because COVID-19 Nankasano. A fee in a year explore, na ye sending the subati, and they send ye nisu and then the bind at ye. Do you want to say? Research be by they are cases see a use nose mask. Research be by say social distancing. Unlike other health-based public health issues, say via the use of seat belt in the smoking now, you bet me at now you're analyzing the human rights issues a woman where the anyanisa inti ama knowingly or unknowingly no a lot of rights have been abused. So, but any in our effort, meaning say going forward, and I a lot of data about the virus, and some of these things will be corrected along the way. Yeah.
Okay, I made a mistake. It's a they say yeah you know discuss say at least we are all going to sacrifice some of our rights.
Sure.
And some of the rights right now we are not ready to sacrifice. You know, somebody in authority will force us to do them. That is what maybe in public health, you know, you call about a paternalism. Somebody will serve as your father. He said, when you say wa wonim say akora we or ye we ya and never no but and crown pi or be on tiasie sa but as a father or as a parent so aban no yes but whilst a parent be brave edem kra e fa no some parents end up abusing their children sounds so near drew condition be say a mind be brave a police emremu soldier emremu health worker emremu no sometimes maybe they go to some extent they end up abusing some people. Now the most vulnerable populations in Ghana, me pamacho ye remo into specifics, are this proportionately negatively affected by the COVID-19 no. Or more include, I think, immigrant workers. Young fans say a kaya yo or free young fans said not a northern part and also free in Krasie aba krum nipa bi mo a mabedru Accra na Kumasi living in slums. And people employed in a low paying or hourly age obi oha you say yakosi dine ama wako fix the mortar ekakra ansana when you be kra the aba ko homa ma ne yire ne ma anya aduani bi adi. These people they are the people who are affected most. People experiencing poverty, who are living in streets, or who also have a risk of becoming houselessness or a homeless. Women and children fleeing domestic violence. I'm saying in some countries, no, they have a stats and I say they are researching into COVID-19 and the rise of domestic violence. Adentre arises COVID-19 na ba ya papa ne maame ne nkora ina ya loko emudan o omotifie no. And then then when domestic violence also are mostly no women and children suffer. And people with disabilities, mental health needs, and patients with chronic diseases. Patients was say every 3 days be of city hospital. Was say obi was say he has to move around buying a medicine. And older people. So these people are mostly affected. Say about COVID-19 emra any adea. Now the human rights impact on vulnerable groups include maybe loss of employment, loss of income, loss of housing. Obi owa wankwa adwuma ekakra ne rent aso. If you age na ne advance or so when you teacher ni and answer then or Russia ko bank akoji loan. These people a lot of a year amount for go through hateful acts, discrimination and harassment. Last somebody was telling me BB from Ghana say a crooked webi and obinya ne temperature no course na ya don't call hospital by na omo isolate na kakra na omo wie omo say oni covid no bi no opia bonten kra na okoto ade a oba ade no ho a na nipa ko omo achi na wa kasa se dokro na obeto a o say yi ba akoko usika kra mempe. So Sanipano, he was going through some kind of stigmatization with mental torture. So all these things are going on.
I think that racism cry can also argue in favor of racism because last time I saw a video in Ghana.
Yeah.
A Chinese man was on board of a trotro and then all the passengers got down. Yeah. Because that was during the early stages of COVID-19.
Yeah. That's pass with it. Now, some of Sanyema way in so government have a part to play. So because of that, government need to put together deliberate human right based approach so that they can help the population now in our countries, especially the vulnerable communities. Because say, Omai Bebre a signatory to UN Human Rights Declaration. We have a number of them that we can list. Na emu bebre a public health for the year juma. One of them is the International Covenant on Economic, Social, and Cultural Rights. A human right for the year juma pa. Ain't macho yanko into specific. No. Human right based approach. The first question I may be saying is Ghana. Yeah, the mrabi bray at to a crime. You see, you have to wear mask. Ofi said, what principle should guide this wearing of mask? Francis, over to me, Akasa.
Oh, okay. I think say we can able to me a free apomodin any sikafem say okaso bi enche mask fine you himself so share mask pe enipa no protecting itself and then also protecting others but also putting in some other conditions I will say as a minor yin na yehwe na yehu bia de befa me de say SHS for no school na ban no echeche mom nose mask mom nka be bisa ho say yes you the right or responsibility to be protecting who no asan protecting the other people so and then the fact say obeka sa we share mask na ho kire won nti no won hye no and no so violate will be right so and then obey enjoy right na who put you be into danger no na and no human right no because who enjoy right it shouldn't abuse somebody fine the wearing of mask in there is the best thing to do but me say any part obey to disposable disposable nose mask no we will better actually since COVID-19 and so loss of employment and other constraint aba any pan sika no binya no they replace those mask every day so put any panel in some financial constraint bia and no cramp no to me one money boom ran so because we be say no beka say oni ska odeto omo use washable ones and so no what is the education provided to them as to how I will be to me washing with just water and soup enough and if any enough necessary you need some disinfectant that would become wire and also poses some form of financial constraint and the kafu be also there beto or mindfulness so from the healthcare perspective there any panel washing no if feeling some discomfort but normal in society we all have to share the benefits and we all have to share the burdens what we try to do is say benefits you be mana yekese na ya limited burdens so I think say with wiring in this situation that is the way we have to go even though we know say the discomfort in bread and for but there is no policy without a burden and then we have to stick by it to protect ourselves.
Yo, Francis, what I was saying. Richard.
Yeah.
One of the angle, so the regulations on mask wearing, no. I'm say you say mask wearing, they say baby I could do no. I international. Everywhere or in most countries, no, it is recommended. Now the rules around it, no. About say a Ghana, I say, what you came now on Kwana with him. I was say, share mask, a police, a bit me actual. How do you compare this regulation to the human rights-based approach? Yeah, the Hong Kong.
Me who say, you do baby because I'm violate human rights. Personally, I can't see and say, me quite me came. Yes, say even crash on obiti crana is supposed to be 1 meter distance. Kai obian timbi. The internet of for semi share mass. I said yes, I bring a no me, you know, you're damn way. Obian kaya home. Oh, office, some office, Obian kaya home. But Obahana was the Abba say, mention mask. I don't think he said a yet. Meaning, said, baby, any pap bang only 1 meter. You do who say, I'm about it. And now, me who said in the present presentation, as a Ministry of Health presentation, be anywhere, Yaka say, so unquam with them as a mask. Unquam with them as a mask. And that's unquam to care much a mask. But you say, baby, I will any pap bang war. And I say, sham mask. Now they avoid it. Yari, are banging, no, I find to say, be been to me in Cowanum. Let me be to me free one. So Emma Unia, Ojina one chain. Yes, yen shamask. And I said, be been to me in Cowania say. Because in him said, sir, I know any Nina, your man do not far echo. And he said, if say, will be any laming chain, I didn't tell me cover man. The me say, a drew by Bina say, I saw you found a political for Air Force in Crawford say, or moon sharp. You bit me a catch on say, and yemra. A bit me educate 2 or more as people with the health knowledge or public health knowledge. I also say, take it. Now yet to be champion on some of these causes because police need to have basic health care. Now I say, so even a health care, and I say other security agencies be bringing some of the basic things. I don't foresee say me to say a advisable.
Tight a precedent. Or say decisions are based on science
and data.
And the decisions now based on science and data, you know,
data.
He science and data. So he has these public health guys or epidemiologists or advising on all these things. And when they are bringing all these regulations now, police, they are just law enforcement officers.
Enforcement institution.
Yeah. So this public health, you know, the reason why human rights-based approach topic comes in is so that we can do away with the traditional public health actions, you know. And how are all these our public officers, our public health distant advising and formulating these policies? Why couldn't they figure this out?
Minya, the mimi who say, I'm going to say Ghana for your swording. Oma obi 9 no I 13. Oma obi 15 no I 20. And see oma won ka say what care mu a she. Like there be what care mu a men she. I say what bedroom a men she. So because you so ordin and you be brave.
You know, say one here now we are saying here we be a taxi driver because say me a taxi driver there, so me my so we are family. So share if he says that,
then you have to take advantage of explaining things to the person. I would say you church woman who say share the be can't in the hospital higher education say nipa who fin say oben wa only COVID and the pandemic COVID as well.
Yes.
Because Uji say, oh, eben there, another Francis do Yeminia, minim no, the out and east, it's the via no coba, or coffee, on cover be a cover the work, only obi men, but one is any power, or could she Kwame seen a dam for a horse one share must, be enough to come free by no unim, but or could see about another yaquasi, Kofaba another yaquasi. The friend said, Nipa, but who is a Ghana, obi a nim no. Obi enim ye hu na ya fa ye mas ye nhye kwanya fa nye de ahye but ye enim no opekra hu na oh John Betana say, you Jao no, you COVID, you be answered. But baby, I'll call baby, I'll call you throughout the day, and when baby cry free bar. Like say, and why holiday, and why weekends.
Yes.
Accountant. Meaning baby, I'll call during the weekends.
Yeah.
Also, need baby, I'm call during the weekends. I wish you Monday.
Yes.
We name me call area COVID yes strong or hard as we name. But me ba accountant, me and on you come or agency. Or the sound until I can say, Obi a wofin say Ojini di and I say we name no only bit me the COVID no. Asra.
But
my downplay.
I have seen.
So we mean or you may sorry.
I have seen a video, sir, or news, sir. You see the police officer having the mask under their chin and directing people to wear the mask. Because everybody have right to breathe in fresh air.
Sure.
But you, the person enforcing the law, say because of COVID-19, no, you have to sacrifice some of your right. But me mask no ebo my body ase. I have seen government officials nipa kuku dampa omo mask bobo ehihye omase. But they are arresting some people. Yetimi ye obi free got taxi mu ma no pra egatemu. But na policeman and I say government officials are all my interview ne dey bona body ase. Mr. Richard, how do you see this?
No correct. Yahubi. Men can quite and pennyful be brave, a bo, a momo. And some say the vulnerable to the low rank people, no the omobo. Me who say a discriminatory, and I yes I introduce you.
Yeah.
So because see if he says a kwame mod the as I could see born. Over my medication, also so mock mask. Intended now catch them. Leadership by example. Leadership by example. So one to me and can, one to me and ya, one to me and can't them so same ye. Now let me who say, go for your minimum rice. Said the can, I know what you made this on my way. It is you on I say, can. Because one time I made rap. We said, so when you come as a crowd, Bantima, be quite run about.
Yeah.
To a soldier phone. One said there's a link here, a peer a doom. Because of the construction, need road the young way into the mostly. Some of us, it me fast soldier phone inside. Yeah, could be a
noche.
What's a soldier phone what? Soldier phone entrance back or Bantima, and a back also a doom close to High Court area.
Yeah, no, Confanoche,
good. Confanoche, you home. We do always have a mask away. I'm saying mask in the home. I'm telling him more. Not when I want to make, I took advantage of educating him. That makes a kind of Obian coming. Ujinaha. That's what would you about? What about you say? They know me and know who is at risk. I ask that question. I see you have 40, and I say, and you're not correct. You have 40 crana, all the NCB rating is stronger than me. Car 1,000 bit come from Bantama, I could pay a doom. Mr. Somin Qua, beer, a minion beer. I have a new deal come back penno and a minion beer. But oh dear, Obia will use root to a beer befa, Obusano, the mask, but what the social one, or the Shawano. Until I hear you open to yourself, and the either Hobashan Massino, another bit in our car will be a chomaco. I will pay. And the guy said, wow. And I explained things to him. Well, so then you are a law enforcer. But who said, Obusa, I'm not saying you madam so. I don't want to mention. Me and Peter come a Juma. The later, I know whom opinion no me can ask the cano. Etalaho. I know so Patroni call. So, and Tia, you no. I want to take advantage of the explain it. Or more of things saw me enforcers no. I want to take advantage of the bullying crowd for. So, but also so yet. And this is some education. I won't name some of these things. I say, yeah, share mask. Into the mask, my version.
Yo, say,
Mekai say, now a bit by M said there was another face shield. Some people were wearing it.
Yes.
About there some days ago. I can't remember. Say the first time who be not unless they were selling it 70 to 100 Ghana. I said, lens be womb. We shall not cover winning.
Aye.
But who said But we don't say ra and change. We don't say ra. We don't say fasro.
Yes.
We started preaching to almost say, and yes, honey, man, hospital for here. Hospital in here say, or bond of face mask now, no share. Say case or yet cases. Say the blood into me splashing.
Yeah.
Liquid it into me splashing. But who will be able to do no share face mask? Nipa or more casa free side. A bit me I enter liquid bit me free the other side, down and other side. The people said this is an education now. You used to be without like knowing its purpose. Somebody become and I was a public health specialist or public health staff. Take advantage in each train population from the big men to the vulnerable ones. Because we say a beboa pa say kasi yes and a beboa.
Yeah, that was a power with this education. A way so Emma you say this human rights based approach one of it is discrimination. So government have to put measures in place to say people will not be discriminated against because say there is a possibility say these things will happen during a pandemic. So a public health approach or a principle, and people have right to be informed, and also so a human rights approach, and also ACAM, because say even they are saying say when you sneeze, it goes to the person now or opposite you, but and hang it it rests on your shoes. And to what is our shield you show when you now what you are sorry them one. And I say the amount for Japan and your studios.
Yeah.
So the person get to the entrance of the studio, he washes his hands, everything well, no wash away, and that's the mask and from the entrance to studio no obetanana kunyan or hinsiwa baby moi. It hits the shield and it drops down. So key door handles near the now. So a true say or virus no be or contaminate the but who feel say wahoro and inside or entrance. So all these things, but Francis, Mami Misa was not Mr. Richard Eka discrimination. Not who say and then saying for example, your opinion be a year. Say the number it was a year no 100.
Yeah.
Na bia obia onibie nipa ebegu na yiase bia the police may come in to enforce the law, but opinion bi ewu and as a famous ni bi ewu police will be there all right, and maybe they are protecting ministers who will come around, and I said they are there to see say people will not fight, but omu nyina ewo hobby because Kumawood stars will come or new omu nyina bejenchia a politician a year. Don't you think say it's also is a discrimination? No, say me ni bi dia me nyo obi adia me yase the laws will be enforced, but panini bi yase there. How do you see that? The discrimination aspect.
Yeah, and no akano. It is a very discriminatory. Before that, my main can be to what Embra Penny Richard Ekanye. With say what it came on. Na minim how more year no matter, but see a can human right based approach there. And you're not all taking decision. Such decisions are we have to talk about participation. More na odo on board to take those decisions. Enforcement security personnel leadership on kwan and in other sectors become send your working because what to came the entire was say face mask when pia bontia bama ho nipa no Etsy Nikemwa, what is the essence of ono quantum? What is the essence of the book? No smash. Say taxi driver, ena or ye juman and kophobia betna kenimu, nkofobiti ne chief fine, and also more dear. Now, private person, no quantum Nikemudi, I think, say, the no idea also more. And then there a clear violation of human rights, clear violation. Now, maybe someone in cry free, and this and ye, any say but in a woman in say COVID no you no respecter of person. Until you there you can go on and downplay say a penny a yes inti oh yeah so more on abu no found. But that is the wrong line a bit to me ako. Ya shemra yes see netie mumi na yendi so. Anytime be a be shemra will be breaky emrano. The person break our progress or slow our progress. Adentina Yakobia yase na ya enforce emrano kama na yebu bidia ya enforce. I think say it is not right, and then it is a yijimu and also no emwa nipa no. Enye say ye de atia omo de ekọ hokọ yire emrano mutare. Na emum omo ambeba otitiri na yase no. Ya moa wo yeah, abiso because we have to protect them. See, you see, the nation's resources, and I did say, man, but also cool be the assay. That's all quite in the pumpy man, hotcher no. I don't know the day, what protecting or fine or call. But to be back penny be yes, no who is all a penny far baho, yeah, relax them rano. Why do you so bomb? But in the long run, what you have violated their rights. You have been discriminatory. Say nipa no onya chance di breathe ye anase wanya chance di breathe wo relax emra no na emma sadness no you have been discriminatory nti too say wo ko obi ho na wo ko we retire no na ba obi ho na wa mayire no what discriminate say obi wo protect no wo baby na obi one protecting or baby no so no why discrimination nti baby ebe fani bia no we can argue in favor of discrimination.
Yeah. Right.
David, sorry. Evan, I just want to maybe something like a crack coming here.
Okay.
Maybe my mum says about is it going a call Facebook live now?
Yes. You're alive.
But mum say and penny for be ministers be brave any COVID. It's a be COVID. Minimum say and that was for my for. Tested positive. Meaning say can a Japan tested positive. Education minister.
Yeah.
Napo tested positive. Ahenkra tested positive. Yes. The number of umpany for. Ujini say be binti na omo tested positive. Unim the entia. The entia me fan on say discrimination no. And that's omo call baby young can show someone share mask. Mask because of say position no na say emrano entimi fa wo nti ene tire bi omkonya bi nti sa
possible na je say ho no omo no ya moa omo
yes
ya moa omo ye police and say ye social security agency no I was say omo hwe say omo so be hye in a nice way meaning say the Ghana for before ne ye managers ne ye senior so tie unim say me ye way e be so je ni ko kan usuro police ni ko kan usuro into what me ankoka anna education no so no every so police for the nuru omo ensem security agencies na enuru omo nsem obuni say we manager ana say we minister dia covid ntimi into wonka ho asem kana mi hu no ti esa ye mo ye mpanyinifo no but ye boa nipa na mo wo mase no because obeka mini hwe ka mehye me de but ye nua mo na ye mpanyinifo a omo rane oman na maya ba akokra ni hɔ a na wa anya adwuma da kra ebetia Ghana manyina
yes
isa nko for kra na me hu se e wo se ye bo mo ho ban yie ye educate omo yie ne ka health issues no and I say education ye de ma omo yie than some of us. I say the vulnerable financial minister nya bi onya ye no Minister Chini pa. And the Volta region, Ochinawa Upper East, Ochinawa Shanti region, Ochinawa BA. And that's our north south of this. Or but media moving from upper west to down part of Ghana and across all parts of Ghana within a short time. And this is another thing I mean to say, why you ministers, you know. And you people are or bet media education that drew the penny name. A police for no cry now more canon. Say you catch up the police for me to be able to share mask. Only my the crop education implication about it. It's not yes, you obviously who on my train. On my train, so or more Jim Frama. It is how many can so the can before the law or something will be implemented. Young say a better education, a query, and sana the ambassador for you see.
Yes.
Maybe a massive crime can or point.
Yes. But that's pa na say am panyin for a yan twa ma adwene ensi no. Wow. I was in operation a theater before. Who say we share a gun no wie na say we gina patients ho a ye will rule say wunsa no eba esro say it doesn't go below your waist. One of the protocols no na etoda kra doctor na and a surgeon na o twetwa nipa or your operation ya na ne re fini ho. So a nurse na ono ye below the doctor no. In the operation theater they shout at each other pa. Please stop. Also don't. Enti otiana sa also sorry. Ne any re fini ho eye nipa. Enti se amman panyifo atitiro se ya mo ho ban a say de usikan one make it very important ayipa say nipa ba ko eyare ana say okofri mu a emra process a ye be fam ape obi asi na nan ne obeko office so free mu nti krampo no handing over bia oman no ebe ha oman no pa wo kwan bi so a we don't have to be playing with laws near the na study another point so I can say minister chini pa MP chini movie star chini yewo politicians be in a day or chini or radio stations bebre so we don't have to create say there's one thing in public health so we are fighting against it us and them. You know say public health institution it started from the Western countries. Now, initially, they were playing us and them. So they would do everything to protect us as we are here in Europe. But them, people in the low-income country, people in Ghana, somewhere in the low-income countries. But later on, they found us there. They found out, say, we cannot continue to play us and them because, say, where did a COVID-19 start from? It started from China, but it killed, I think, Italians more than China. It's killing Americans more than, so you can no longer play us and them because everybody's problem that is a threat to the public health is a problem for all. Enti yebesre say a Ghana a minor you can't say bra. COVID-19 is exposing a lot of things though because Ghana na mra bebre o ha enibimo us and them no ekoso ewo a Ghana pa.
Yeah, and then even only baby with this issue of leaders in society I say the agro. But aside they say, a kind everybody elected a nipa for fraud. In the worst case scenario, say coronavirus, leaders nibi and penny for nibino. That's the worst case scenario. But the young say actually nipa no. It also go to the extent to deepen the inequality gap simply because a nipa no copy. Let's a normal Ghanaian that honor no that honor say you do be two ventilators so automatically the Bema leader. And since here no and only see we are also competing for health resources. So I think say yeah, many broader perspective now. I think say ɔmo bɛhu sɛ in fact ɔmo ho hia na ɔmo adeɛ bi a ɛyɛ concerning ɔmo nso yɛ very very costly a ɔmo bɛtumi ahwɛ ɔmo ho so yie na yɛnka sɛ ɛnɛ yɛakoma ma wo nti ɛfiri sɛ ɔyɛ panin nti you can just do anything you want. No.
Okay. Madam say, may a time no echo. Now may the 4 principles be on a human rights based approach, not to her. I took it from a Canada. A Canada say, you know, most that the committee at home make sure say COVID-19 is affecting many people. Now they'll make sure say the human rights way no or take actions be and man may more so there's a committee or more that now their principles no. One of them a approach to prevent and treatment of COVID-19 as a human rights obligation. Now I'll say all levels of government have a legal obligation to take preventive steps to stop the spread of COVID-19 and treat people who have the virus without discrimination. So this point, you know, I think say no ena ayakan. Enti yamfan say ye bra penyini Richard the institutional owomuno. He has the obligation. Radio stations have obligation. Every government institution, every quasi-government, private sector, every baby nipa etimi babeshi and say if you have a responsibility, you have a right to enti a nipa no right say me uncle me kone yase a government and I say authorities are responsible no obligation say omuma me a right of enjoying my preventive measures now. I was me enjoy during a pandemic. So that is an obligation of a government. Now, another thing, this obligation includes mitigating potential impacts on rights that are interdependent with the right to health and life, including the right to food. But I don't know.
Right to health.
Right to health. Or say, this obligation includes mitigating potential impacts on rights that are interdependent. Your right to be more one depends on the other. Inti workers a right to health and life. No? It includes right to food. So obi ani dia obi. Obi ani dia obayare.
Yes.
It includes housing. Obi koda bonten a obetimi anya pneumonia awo ne from abone
malaria.
Right to work, right to education, right to equality, right to privacy, right that access to information. Into all these things, no say inhumane or degrading treatment or punishment, and the freedoms of association, expression, assembly, and movement. May pacho be making ubetimi aso e baby because na obi ye argument be say a government ema some months say e wati nsuo so ana nsuo ye free meboa.
Yeah.
Upa bia yenkura yetimu na Kwame Nkrumah time na ana say bia buzia time omule pipes no ba bia kodru ye no omunle bi nka ho into Kumasi tratre nkran tratre many people don't have access to that nsuo na aye a free no. What comment would you say about that? Because we are saying, say, these rights, there are interdependent. Right to food, housing, work, education, privacy. Obetia, you say, Francis and Richard, Ayaria Kodeji. Ain't young for any funny in a G Metua Bonting. I'm a fashion, Richard, or Obetia.
Okay, the first one is about the. Now you were making scenario on this water. Now I'm saying my name say oh the free Ghana check a crap. My name that of Francis. But who said I can say that now the pipe-borne water in Ghana. Yeah. If I do like analysis here, make us say maybe a pipe-borne water, I want to base about 25% of the population or in the country. Wow. But government the ECG power I can home. Don't do no true that or my dege when the war and ECG na say power I supporting no. The one way or the other, I'm also benefited. Okay. I'm more two months no, I'm more benefited. But that's what you say.
Yes.
And see, my friend say, "Ebia yenua mu bi kra na omo kra kra na omo tunsu omo dey ECG na pompe." Okay. I'm on one way or the other. I'm also benefiting from ECG. That is why me who say omo dey water any ECG boom omo ye no. Because okofa water nko a na nka say ya nya fair to yenua mu bi omo wo nkra bi ase. And na say yenua bi omo wo nkra kesiem. But what the ECG account, my friend say obi ya benefit wo ho. Okay. Concerning the piping, I can say maybe President Buzia or President Chroma time, maybe you do, you know. A bunch of them, but Uncle Phone, but that point, you with me, I said that is why I'm with the power attach, you know. And see, and yet, zeros are it drew a portion be, you know, and information, meaning say we have confidentiality in line of healthcare. Yeah. Okay, your rights of patients. Maybe we will discuss it into detail in a day to come. Yeah. There's a law set to me in fact my healthcare information and my a third party, a different person, unless you seek a consent from me. Maybe client, as a maybe patient, you know. And these are other things here. I mean, who say a professional health worker will not do this. But present information a slippery through and then confess or more publishing. Let me tell you something. I'm very close with my accountant. I'm very close with some management members. When we send in the hospital, I say when we send where the friend say swaps, you know, it takes samples near send the near require. Either they give it to me or the medical director, me and the administrator or the medical director. At times between me and the medical director, cry no obin can be mobi hubi. Yeah. Me medical director because of the concept and I say, me so meti ase. It will be crying. Unless say you make it update, right now. We mention the numbers, we don't mention the names. All right. Even your psychologists, clinical psychologists, time or so na you percent your education. We use some medium and the year education. There were 1 year COVID in terms of giving education. Yeah, man, those things in and use medium bina ya dey. And me want to say it depended the person. The information equal bonting. Yes, I can information be man can encore. I don't think say Minister of Health and that's a medical director be a big information that was say may facility kwame boating akwesi kwadro ya and not tested positive and you paste it over there. But you say bia nipa de ye wo nipa. Ye wo nipa. Nipa bi ho no mo a anya ye wo 1 out of 10. Bi ho no mo a only your lifestyle and your peda. Unim kra na opeso ye me go phobia opese me na me kan ma obi ti bie. There's some human beings only aka wo dey information me boa ye hwe ya other platform so and if go for no ma san a ye hu se san ko no bi wo ya kwan bebre. These are the things here ACA but enye say health workers be disclose our information ama ewiase nyina anya bi but kakra akoma be 1% bi na say 1 bi a wo hyemu a o yes stubborn a on the emra no nimpa so no person can be who say on a kind of information thank God for no so
rich yeah that was a power for this education we and ke benya anka time e wo ho anka we go deeper into this but mre nunti because say a drew time be a once be a WhatsApp platform so crana information be and then I'm so another angle cram pony so who say a crack it to be na on shashi na ubi share. I say don't be the first person to share this because say a police for name running for purpose or them run pa ye juma pa chin well we can share and now wow share be the bia obetim de ho ato ase enti Sir Richard Emma me kwan say me mfa ne health records enkoto abonten na me sha of course key figures be they say be a UK yate prime minister yate prince so asem be a Ghana a minister bi mo na ono a grant interview our mom kwan say mo mfa nto dwana amanfo hu say yade no nyina odibre so enti a eno na betimi a preventive eno but enya saade a we shouldn't be in hurry to share people medical records all those things na Francis me pacho eni ma na me bobo so no Mr. Richard aka ene de pacho also kakra de beka.
Yeah, Mr. Richard attach on most of them privacy and access to information. Me person me share the freedom from cruel, inhuman, and degrading treatment. With that, and I will link it to stigmatization. The stigma, any send you treat you or recover from COVID. You know. Yes, that all my example be say. Nipa no kra we nyu ye se we temperature na kosoro na be taking the sample cry call ye se we nya bi afi wo kota ade a na nkofo ye den edwane no nso metie some interviews bi a omo ma recover ni bi aka se o ye de no call no ba fie no na ire ne makra kota ade a omo mpese omo de be mo omo sanema we nyina eye nkofo fa ho bi ni yetiatia so already no medical practitioners no a qualifying nkofo no say yade no omunya bi na momekọ and back to society but ye pe na ye bu omunimtia ihu omu na ye dwane omu enti violation of human right and also no also education etumi koma ye nyina because say o stigmatize bi sa na o ma no akwanya say enipa no ebetumi ayeden aspread so ho nti enipa no kra no so wo bi ena ya betwe ne sample kra de ko ena yenya mefa no a because o be ka kire wo say o me kra betwe mmogya ko de o de be ni nti no won kan kire ne hye no ho na one wonam ne so uti anko yeyi na se nipa no ye no krese wo bi a na kire so oyeden or spread it nti no de make nyina ne say education intimate education on that. Anyone else will call next will near be bar. No waton or befia no waton or just normal say near your nam honor. So this year you need research to me research into the immunity. So we now build immunity to that. So can you power when you been crying? If it me I say no, our chances so will stay healthy than what we need been. So indeed me when say information and on that aspect as Ghanaians because the person you man. Na ASMY.
Yeah. Okay. Yeah, well,
I mean, Cassim Kakram found 2 million. So let me make another clear example.
Yeah.
Staff binyabi. Yes, psyche staff from Ohunina, psyche people are also more supporting. May the driver air call. When driver, he taking the person to an isolation center. The driver told me, say, Uncle, Oslo. I told him, say, I will sacrifice and go with you. I will sit in the bus because that was the time when I covered the bus for now. You catch and say, don't say your bus, 35-seater bus. Or better than front. The positive client, you know, better than middle, me better than 4.
Yes.
And he said 10 meters. This guy told me, say, Uncle, begin to catch us on the crown echo. Uncle, I'm saying, me, as an administrator, I'll be part of it. Yeah, there, don't say uncle. Oh, the sort of Nipa one in a tear, one in a coba, o yare or your nurse, o kono hose wo me panie. And then wa yare na fa ne tena ka mu, na fa no call ayare sabia na so center o si usuru. With all this education, I demand no. With all say sacrificial me yes, metena mu na ma saving me staff. But this guy wasn't ready. So if say you can see a fire now, how will people criticize as some of us, the managers?
Mm-hmm.
I'm just putting a question to all of us.
Yeah, I think or in nursing, you're entitled to the right to health. Yes, also you're entitled to that. And then will do some bed driving the narco. Wow, was a won't con overvalue to be right. So overvaluing the right. Say also what are you going to say? Say in or because or a casualty to COVID-19 loss of jobs and is he going to say that?
Akwa say a soldier near and tokwa apa. Na enuntino osi wajai a soldier. And now say ye wo environment yimuha as healthcare a professional. So one of my bonten kura na sa oko to scene obi here medical attention. Now we have been trained because education is free to university level. Yeah, your minor tax way at your school. Now our medical knowledge on BB. Now we ignore. Now later you won't say ampa. You intentionally ignore the person. You can be prosecuted. Ain't it?
I know. I remember my 10-day workshop. A lawyer told us, say, hospital now we juma. Na say staff will be proved difficult. Or if you after emergency be about case be about you can issue police warrants for the person to be arrested. But when you Ghana, how the society present issues, how people welcome issues. When I be who say human rights activists, when I be who say gender.
Richard a distraction ebemo ekakra na ye twen na ma waba back back okay Richard aba back. There was a break in your connection.
Oh, sorry na me pick presentation say nipa we am fa we nkono e beduru mre and ka say o twene ho but nipa we say o issue and warrant say arrest no. And I said, "Oh, I know where Juma Ghanaians will come in. I want to be human rights activists. I want to be gender activists. I want to be people who know the right of workers. I want to be TUC. I want to be GRMA. But yeah, now you really say a nipa ba con life and na obi eya ma ye lose no.
Yes.
Ghanaians. In one way or the other, a drew maybe a hypocrite.
Yeah, too quick to judge. Too quick.
A drew baby, as I'm not working.
Na, can say, and you might be brave. I think, say, Saudi America, CDC. Most developed countries, they have a department dedicated to a public health issues, because say a hospitals not they don't concentrate that much to public health. They concentrate that much to primary healthcare and the other sector of the health. So things like COVID-19, to make sure say people will be served the right way, the public health attention, and as the public health services that they need in the country. I think say a government and our president and can say they are going to establish that. And Rano can say they are going to build 88 hospitals now. He says that they are going to establish that. And Obai and also I think say a year ago they have established a health promotion unit under Ministry of Health. headed by Dr. Is it Da Costa B? And I think this COVID-19, people have right to know, and they have to increase their health promotion efforts. They need to step it up. And idea back one make fa nipa na or twene ho ene ho no. Schools are yabie. I wanted to see say a teachers no and as a staff no, maybe they have a full PPEs. I think when they talk about PPEs, they talk about mask and kwa, but PPE say could do term B. Not say the teachers are very suspicious of a Caribbean and say we here and say BBC non person motachina. I think they can dress it quickly with gloves and all that protective equipment, so that I was say or obitimi a far crown bonnet ne bokra no teacher ni ka bi or mutimi de shim kra ni ade a. It also helped to reduce that fear na ebia ebeba no. Into providing those masks, 3 masks for each kid and each teacher, they could also add that a PPE in that gown now, or more front line, or more say in case they are very suspicious of a case, they can come in to help. And yes, nipa na enya education kasano. Ombetwetwe omo ho saa ma obi akwa akwohwere. And then
it's true. Some schools be I'm follow on other agencies.
Okay.
So as I government make it really in some schools. Our own school was 82.
Yeah.
I can't remember the executive brought a proposal. So these are the things they will need. And all students should help. I can remember say by news, we were able to raise money to procure some of these items to the school.
Thank you very much.
Ochrenabi, if I say, Ochrenabi, or say to secondary school has been hit with 100 COVID students, COVID patients. But you want to say, until me queen it will catch a stigma.
Yes.
B. It in Tempana now see a gather sika. Na se bibi says, yeah, said your kind say, I could be crying be a teacher, everything you have on a bonnet. We're able to buy cover up, we're able to buy overall, we're able to buy a mask, we're able to buy some caps for a session, a number. When there is a positive case, this is what they're supposed to use. We have been able to finish the school dispensary. Now with the fullness, our autonomy, there are some basic things I'll be to me and son you're transferring to the next isolation center. And if you say to me, preach some of these things here to other institutions now, they can help.
Very good. I think say the Ghanaians have that so they say the private COVID-19 fund they have been able to build infection a hospital within 100 days. A amount for a collection and to want to where that maternity wards now they would see how many years 46 years and yeah basically amount fund and to want to where so at these things and so there was can multi raise funding things say asempano a Christopher asempatre ejumadi asempano e was say a tray a wine and a day a betre we are praying say obia be na afamu de ewo e Ghana yenim say nkomo a yedi nipa ba akompa bi e na atekra eso ebeba mfaso a Christopher abunkam ewiase nyinaa nipa ba akope Jesus Christ through 12 apostles enkramofo adolso nyinaa nipa ba akope Muhammad sa enkakra so bi eye na afamu de na aban so eye na afamu de na aban so ye na afamu de no you should be reminded say there is something called human rights. COVID-19 you are sacrificing a lot. Now they shouldn't take actions to compound it, but they should take deliberate actions to reduce it ekakra. Eminia, yanka your last word. Na message be na ye di ja obi a otie.
The Mecca and say COVID-19 a rare ewo. Na ye hu ni ko fo bebre fa say ba na ko fo hu ni say e wa chire. Yanyini. Me hu ni say people tested positive and I say e kun people bia yanimu a na man krofo adwene asatra na ma ye extra careful for nansa pe after nansa na chi kono ya say see them. I can remember say John Wu ye people were attaching it to Ghana for ye and ya samaba na ebi mu kra can beginning say eni ho government dey raise sika the government dey pay sika anka such a huge personality like Sir John aban betra ho amanawu. Look at the doctors are omawuo. Doctors omawuo nipa se force and omunya specialists, some are even consultants.
Wow.
Government investment to produce one consultant is kakese. Government investment to produce one specialist is kakese. Enti ebetena ho amasan krofo we ewu. Yentena ho. E wo se ye hu se yare ne e wo ho. Na niema e wo se ye modalities mass. Ye wo hro yensa, ye distance ye ho. Yenye way, not way, anyway. Yinhwe ni ebeye. President Ama Enra, President Kansen Bebre said now yetimi kwa sorry 2 hours. Yetimi te mu in the 1 meter distance. Now population now there's a caveat to be any so obetimi akọ. But I was saying observe protocols advice na President Kai Yes a year. You betimi a year na manipa 500 aba year no. But I'm say approach by the year no.
Yes.
100 transfer. Ya catch am say 100 we mo sorry na mo nko. Mo transfer for kakra bi about 45 minutes. But bon sa abo 45 we mo nko. Na another 100 so enter say. You bet me year na me nipa a wo say the year no. You plan year, you say you hu year. You bet me a year. Men ka say do year to ho say COVID-19 twamu ansa. Cause as you can add to ho a okay, say all the flu no kwahye mortuary no. Say you can timi tua school fees. Say you can timi feed you. Say you can timi ye adwuma foforo emma eso Ghana nchirima mom so nya bi ko oma no. E futo kra me kan no say yenhwe na yemfa ensem a president ne specialist no e de to dwa no yemfa nye adwuma. E be boaye, e be boa so. With us.
Yeah, that's good. Francis.
Already, I think a penny jari and then kasa. But Richard a canning in a can't see me in a best say the Richard a canning in a be so protocol say they are being in a yin so in him say Ibu ya abuse some right to be a yin meaning say as time goes on penny force one share not do serious thing in a almost corrected. Appropriate authorities now more enforcing those laws no. Those seriousness, my enlighten on kakra, send a bear, bed day na a day bread or man for so a subject. The person make
Yo, that must say. And a deliberate human right based approach. Without a deliberate human right based approach, COVID-19 will further exacerbate existing inequalities for vulnerable communities in our country. Because of that, and into a buying not all children, and into a electricity so, and into watch insular free, and into all the allowance maybe total health workers so, a buying a na from dear. That's it, meneo so yeah from dear. Yina yebeko agye man na se emre bia no se aban mu nipa ana se a doctor for any a nurse for any mpanyinfo to say Mr. Yenua Panyini Richard I no di nkomo e can say we have to learn to live with the yade na on pantre say yade no any aba betena fe boy into no relax the all part training say yade no aba yenya no aduru enti no bo yade no ho bra na wo ne no entena se wo ko school na obeye sojani a wabeye sojani awie so you have to learn to wear your boots even when you have to wear it and sleep on the battlefield you have to wear it and sleep yada obi bia se utie ye na obehye enkomodie ama asempa no atre asempa de e wo se etre minua wo so medamase se mo spend time yenua Richard a Monday na wa ye adwuma meeting upon meeting from 7:30 so as in the office crowd no ye meeting afei ena obekofie ne yere ne ne ma e wo fie nanso onim se anye bia de onipa baako bi ebeti nkomoyi na ono so wa share yenua yeda ase yenua Francis so owo Sweden emre enke wo se order ono so o se oni ye bedi nkomo e kakra yeda mase efiada ye besan edi nkomo efofro about the rights of patients and the nurses the doctors Ghana for etwa adwopa say ena nurse we handle me ye doctor we handle me ye me call hospital kra ye bedi e no so komo ente Richard say okofia nyame fa nkodru fie.
If I heard you right, the band and I work on
Friday.
Friday a public holiday in Ghana.
Oh, good. Intino over available.
At times where I will be, the catchments.
Okay.
A factor. Maybe they are rescheduled to a different date within from an Ochinakosi Thursday. In the same time, I can be of help.
All right.
Yeah.
You himself Friday, ye nyao kra and afofro. No. Ye be nyao. Say yada wasipa wa availability. Inyame any obibiara entena. Bye bye.
Bye.